Now, I think we might as well continue. We would deserve a little break, but since we have eaten into the break time, and I see all the speakers for the next panel already lined up on my screen, I think we can be a little, how shall I say, diligent and go ahead with the second panel, which after all is very much connected also with the presentations, the messages that we have heard in the first panel. There is not really a great difference between what we heard in space and industry and what we will hear in space and health. I would go ahead and ask Lucie Campagnolo to intervene. Let me say just 2 words about Lucie. She's the coordinator of the Downstream space applications at MEDES. MEDES is the French Institute for Space Medicine and Physiology, based in Toulouse. Obviously, the name MEDES is a combination of the 2 French words, medicine and espace. And as the name says, MEDES' goal is to develop a French competence in space medicine and physiology and promote the application of space research in the field of health on Earth. I'm sure Lucie knows by heart all the experiments carried out by Thomas Pesquet on the ISS during his 2017 mission, and of course also those that he will carry soon in his incoming mission next year. By the way, with the new ship Crew Dragon, so he will experiment the new vehicle. So actually, we are eager to hear from you, Lucie, your experience, and know how these medical projects carried aboard the ISS may lead to drugs and medical practices useful to living beings on Earth. I see already your presentation on,
Great.
and I let you talk on it.
Thank you very much. Do you hear me properly?
Yes, we do.
Yeah. So today, of course, I will focus about healthcare, which I'm coordinating at the French Space Agency, but you have to keep in mind that we do the same strategy for other applications, such as agriculture or food or mobility. So a few words about MEDES first, for those who are not familiar with our institute. MEDES, so it's the Institute for Space Medicine and Physiology. We are a private entity, but with public members. And our 2 main members are CNES and Toulouse Hospital. Our mission is to provide expertise and operational support for space physiology and medicine. So it's quite a niche activity. And also to support ground-based clinical research to prepare future space flight and to promote societal application. So these are a few pictures of our facilities. You can see on the top, which is our space clinic. It's a physical structure that is in Toulouse Hospital in Rangueil. So we conduct lots of clinical research and study. It could be to prepare space flight, but also to evaluate new e-health product or medtech hardware. We have also a team at the French Space Agency supporting European Space Agency into organizing some physiology experiment on the International Space Station. And we also work into promoting satellite-based data for health application. So what are we talking about? We decided together with CNES, it was approximately 3 years ago, to organize ourselves through the Connect by CNES initiative to really shift from a techno-push approach to a user pool approach. So basically, we position some thematical responsible. So I'm in charge of health, but you have my colleagues that are working on other sector. And we had a kind of blank page, and we had to together decide how are we going to attract this market so that they become customer from the space segment, and so that at the end it becomes a kind of sustainable ecosystem. So we decided it's a very simple way of putting it together, but we decided to be organized and to have process for all of these activities. So to, first of all, to know our market. When we speak about healthcare, what are we talking about? Are we talking about biotech or pharma or other application? Then to develop a strategy to engage those people. So meaning that you have, first of all, to let them know that you exist, like the space activity exists, and how can they benefit. Then to define a kind of proposal value. And for that, we really need to know exactly what we are talking about and to do it with their words and not our words, which is quite complicated. And to organize ourselves at the French Space Agency and at MEDES to be able to answer the questions they may have and redirect them to supply provider, and commercial people, like some of them are around us today. Of course, we have a lot of promotion, and we try to close the loop and to always improve our methodology so that we are as efficient as possible. So when I talk about know your market, when we speak about health market, also this is in French because I'm mostly working for French territory, but I'm sorry I didn't have the numbers for Europe or for other countries. But basically we cannot in French compare the ecosystem of medtech, so everything that is linked to sensors, biomedical sensors, to the biotechs, to the big pharma, to the cosmetic, to all the people that are working into the well-being. These are completely different actors, and they don't have the same goals, and they are not organized the same way. So we had somehow to penetrate all this market to be able to understand them. And how do we do that? Because I'm basically alone working on that, so I cannot go to them and meet them. So we use what we call multipliers. We had some partnership with all our healthcare ecosystem and cluster and incubator innovation center. And we just approach them, we explain them what we do. They help us also understand how space data, space hardware, knowledge from spaceflight can benefit their members. And some of them, like Lyon Biopol that you see, is really more focused into infectiology and pharma, because you have big players such as Sanofi or bioMérieux that are living around them. And you have other clusters such as Cap Digital, which is really more specialized in everything that is linked to artificial intelligence and digital application. So we work with these people and we ask them somehow to translate our message to their member in order to reach as much as healthcare actor as possible. Then we try to engage a community. And for that, we developed a branding, which is called Connect by CNES. And we try to have an active presence on all the networks, but once again, by having the point of view of this potential user. So we are present on Twitter, LinkedIn, and YouTube, of course. We just launched a collaborative website. I believe that it's in English too, but it's true that we are quite French. So trying to explain if you are a startup, what you can find, who can be a point of contact, who can redirect you. We do lots of video to promote our activity, and we try to be present at a congress or events that are really dedicated to healthcare people. So we don't go usually to space team congress, but more to bio, for example, which is a big congress dedicated to biotech and pharma. And to do so, it's a little bit weird to have the French Space Agency, in the middle of the healthcare people. So usually through our partnership, we partner with some people that are going and that are happy to work with us, and we share, for example, a booth or something like that. To engage our community, we had also people, we tried to personalize the French Space Agency, because lots of people, especially the startups that are working in e-health, sometimes they think that space, it's too complicated, it's not for me. So we had these people, we call them the marketers. It's basically people working at CNES, and they go physically into this cluster of innovation, into this incubator, to meet the people, to discuss with them, to be able to give advice and expertise. Of course, it was pre-COVID period, but we still continue to do the same virtually. So to have a kind of access, a single point by geographical area. And then the most complicated thing is to define value proposition. So we did lots of work to say, okay, what do we have in our pocket, knowing that the French Space Agency, we don't have anything. The idea is that to stimulate the healthcare market so that they go to the provider and they do their own tenders, or they hold the consultation and they write what they want and they select their provider. We don't sell anything, and we are neutral. We don't redirect these people towards a specific partner. We let them do their choice, but we just let them know that this exists. So we have satellite data. The other thing that we work, it's co-innovation for human space flight, because we see that in healthcare there is lots of topics that are similar on Earth and in space, especially related to aging or chronic disease. So we need for both activities the same piece of hardware, the same innovation. And the idea in co-innovation human space flight is just to gather CNES and other space partners, to gather healthcare partners, everybody give a little bit of money, lots of expertise, and we push the project together forward. And at one point, you have the products that go to space and the products that reach the terrestrial market. And then the last part that we are trying to work, it's everything related to the commercial utilization of the institutions that don't have any data scientists in-house. So they need very simple tool. They don't want to invest in this kind of activity. So this is what we do. In terms of medtech, this is an in-house project. We aggregate lots of startups for this one. It was, as you mentioned, used during Thomas Pesquet's flight, and it is a simple assistant for personal care. So the idea is it reminds you when to take your pills. It do the follow-up of your health status. You can log on all your nutritional intake, and the next step that we would like to implement, it's for both space and Earth. So this is really the co-innovation. It's the artificial intelligence part, where this tool gathers all your physiological data and then is able to provide a recommendation for you to improve your well-being. So this is really the typical example where we have like people from Earth and from space working together and trying to advance the product faster for two different markets. And then finally, we are currently really trying to understand the exact additional value of space and microgravity for drug discovery. So this is a courtesy of, I believe, of cases, but it's just to illustrate the proposal. We would like to go to all the pharma company, but we need to go with a very concrete proposition. And then, as I mentioned, just to finish my talk, we try to organize ourselves, and for that we are a small team at Connect Greatness, so we cannot be everywhere, but somehow we copy the organization of the innovation cluster. So we are present in the promotion, so this is done in-house with the CNES people and MEDES people. So as I said, we have lots of promotion going on. Then we partner with incubator in order to redirect this company to specific incubator. Example is, of course, ESA, Business Incubation Center, but also local incubation center that we have in France. We also take part of hackathon initiatives such as Act in Space and Copernicus Master. Then the main of our core offer, it's regarding expertise and patent. We try to work a lot with our legal colleague to make CNES patent available for any new startups or companies that want to exploit them and to do business on Earth. So it's mostly related to everything related to satellite data algorithm, for example. We organize ourselves within CNES in small teams dedicated to help users that are not familiar with space. So we have Cesar, which is like 3-4 people really focused on SATCOM. We have also Earth observation lab. So 3-4 people, we have a physical space, we have some means, and they can help you and say, okay, what's your problem in your daily business? How can we help you? How can space help you? We at MEDES, so my colleagues are providing a space medicine expertise and also sometimes access to our clinical facilities and so on. And then the big problem for all that is funding. And we want to stimulate the market, but we want to be CNES only one customer among other customers. And we don't want to be in competition with some commercial provider and paying instead of stimulating this ecosystem. So for that, we redirect also the company towards different initiatives that already exist from ESA, of course, with the ESA business application, but also some venture capital that we know that are specialized in space company. And Space Ticket, it's also an innovation financial scheme that is in France. So we have someone in our team that is really specialized into funding and can redirect and help the companies that want to do business. And then finally, we do training. So lots of time I participate, on my colleague, we participate in session from university, and it's the same idea. We try to go in university that has curriculum in health in order to really communicate to the health professionals so that when they come, they graduate and they go to work, they remember us and they build projects with space. And that's the end of my talk. I hope I was not too long. Do not hesitate to contact us, and thank you very much.
Thank you, Lucie. I think I will introduce a new tool, this music box, to signal when it's about time to come to
Sorry,
it.
sorry. I was thinking, oh, someone has left his phone on. I'm so sorry. I tried to be quick, but it's always the same. I wanted to say everything I had on my slide. I hope it was clear.
Okay. No, as a matter of fact, we probably need to learn more about what you said, but this is a good introduction. Now, I move to the next speaker. In my list is Giorgia Zunino, Strategic Project Manager at the ASL. ASL is the health service company in the local area in Italy, and this is Roma 1. Dr. Giorgia Zunino was the Director of Design and Planning Office at San Martino Hospital in Genoa. I'm from Genoa, so I read this with particular care. In 2014, she reoriented her career and dedicated herself to further apprentice in the management of medical services, adopting emerging technologies. She got involved in several international state-of-the-art experiences, and today she is the strategic project manager at Azienda Sanitaria Locale, ASL Roma 1, tasked to create a live lab in the Santa Maria della Pietà Park in Rome, the health and well-being park where new paradigms in space are explored. So I believe that Giorgia now will talk to us about this experience that she is running, that she is working, and we are all curious to hear about her talk. The floor is yours.
Thank you. Thank you for your kind introductions. Could you please, could you see my presentation?
If you have a presentation, you must share screen. Yeah. Okay, here we are.
Okay.
If you make it, yeah, that's it.
Yes. I'd like to speak to you to the 3 challenges on the Earth and the pandemic crisis that we learn from space and vice versa. I'm working on the health domain, and I'd like to tell that the interesting differentiation about the theme of this session, because health, medicine, and pharma at the total different environment, and I want to tell because we face in this year the essential catastrophes that the Oxford University call the existential eucatastrophe. We are look the strength of the weakness of the two definitions of an existential risk. We are at risk, our humanity is at risk, but could be an existential hope. We have the chance to change everything, because in this period, in this time, we face that the king is totally naked. Before the 2012, we said that the Italian system is the good of the good system in the world, but we face that there are a lot journey to do it. I want to tell about what is health. Health is a state of complex physical and mental and social well-being, and not merely the absence of diseases or infirmity, because we can have people in health, but they have some infirmity or handicap. That is the definition of the WHO in 1945. And a lot of work is did it in the time, and the health is a lot of part of multi-layered state of our human being. That is a sposome, it's a completed part of social experience or environment. There are microbiome, epigenetics, but it's not all, because in our mentality we think that this layered is 2D layered or even at 3 dimensions, but the earth is something like that. All data are connected and on long time distributed. So this is a complexity of our health. The challenge number one that I'd like to talk with you is a vision. In space and NASA mission and our mission as Artemis, NASA and who work in space create something that not exists yet, and they are prepared for unexpected. In medical and in healthcare system, in our healthcare system born in the early year after the World War II, and they're not prepared for changing. They have, we have a mindset that is not fit this time we live today. We have to shift from episodic to pervasive, like in space do. From delocalize the service from hospital to home, desynchronized act before the event appear. From siloed to cross industries. Cross industries is a theme that I'd like particularly because I was invited last 2 years ago in 2018 at NASA at the Johnson Space Center in Houston at the Cross Industry Summit. We met all industry work on space and innovation. I meet international chef, stylist. There was the designer of Marvel comics and gaming. There are NASA, of course. There are Rover, Boeing, United, and other industries work for created that not exist yet, and prepared for unexpected. Today, we are not prepared to the unexpected. this is a recent tweet of Refik Anadol. Refik Anadol is a media artist. He works with data and create something of special environment and installation that move with data. And they tweet that started that collaboration with NASA JPL Propulsion Laboratory. The Propulsion Laboratory work, Jet Propulsion Laboratory work on habitat and environment, because stay in space with the same vision, with the same clothes, environment is not fit for human. I like very much this approach of NASA. The challenge number 2 is the serendipity. And the 2 days ago, Starship second stage module make a test, and after only 6 minutes and 40 seconds, they crash. But Elon Musk say, nice work. SpaceX works as we in our culture not are too much affected, because we can learn from error. We have to hide errors and not iterate, and not learn from context-enhanced data. Because I think SpaceX, after this crash, test and evaluate data and every context data. We not do that in hospital and in healthcare management. This is on opportunities. It's a challenge, a big challenge with the change mindset. The challenge number 3 is engagement. I saw that the project Artemis have a mission to engage people to the project. A big vision need people who are engaged to this vision, to big goals. So they I think at the headquarters, they have the project to engage people, and I think not to communicate the project, but to collaborate and start to push forward people to become citizen science. And this is it's very important, because for us is empowering people, have very important to health literacy and civil preparedness, and so face this challenge. We face that if people don't collaborate, to his isolation, to other stay at home and other indication, is not good for contain the pandemic and the virus spreading. But I'd like to do. I'd like to talk about the project that I work in Roma, the Health and Wellbeing Park, located in Santa Maria della Pietà, in ex-Ausilium and mental hospital, building in the early 19th, and in Roma, in the northwest of Rome, is a large park with 37 pavilions, 200,000 square meter of wonderful park, and we work on engagement people to change the approach of health. We try to design a new model of medicine that is another kind of science, the well-being science, and we need the data and to measure the effect to a proactive medicine instead a reactive medicine. Today we apply the current typical intervention that are too late because there are irreversible diseases, there are something wrong in your body, and it's not possible to come back at the timeline in a baseline risk. We try to work in a proactive medicine. We work in promoting of health and biopsychosocial components of health, and we try to define a new science, and we need science. The science needs data to prove that our initiative is good, and the Health and Wellbeing Park is the site, the pilot, where we try to test this kind of a proactive medicine with people, engaging people in a big citizen science project. And we start to use psychometry and reality mining applied to health and well-being science. Is a part of social science, computer science, and like data mining, we try to know the context, the environment of people. Use the park, start activities, and etc. And the first activity we do is to create the digital highway. This is the perimeter of a park. We see you can see the pavilions and the park with the connection. We create a digital highway. There are nothing of this in this park. Is ancient park. And we create a Wi-Fi mesh, and we have a supercomputer to analyze data. We have no people and who works in data, so we try to communicate this project to looking for partnership and people who is interested to analyze data. We are interested to know what happens out of there. When the satellite's image could help us to know with our anthropologists, our psychologists, our neuroscientists, and our people who tells what make happy. Another project inside the park is a live lab for civil preparedness. Is a CMAB, a simulation advanced training, and a human lab that we training people and medical operation with the complex and unexpected environment. We start to restoring this pavilion with 3,000 square meters, and we're looking for partners who are able to use to create content and make real this project. Another project we work for the next 1,000 years because we have a project with future people and the future astronauts, because astronaut is the people and high scale of physical preparedness and mental stability and people over the media. And so we this project is called the first 1,000 years. We start from the womb to the tomb to take care for the people in long of their life. The first day start with the pregnancy of the woman, and we learn and teach to the mother and then their child to be best people, healthy for a long time, because we don't need chronic diseases more. We face a future with older elder with chronic diseases that could threatening our system, and this is a important project for us that I found similarity with the Australian Foundation. Is very interesting, their project, and so we can start to collaborate. Thank you. And,
okay, well, it was a very original presentation, I would say, even with a touch of philosophical approach. But unfortunately, we are eating into our Q&A session, and we need to carry on quickly. So I have Yossi Yamin as next speaker, the founder and chief executive officer of Space Pharma. We heard about Space Pharma already before by Lucie Campagnolo. Space Pharma is a biospace company which aims to revolutionize the exomedicine. This is a word that is not yet of the common language. It's a neologism meaning medicine out of Earth. In the framework of the scientific cooperation between Israel and Italy, Space Pharma developed the mini lab Dido-3, which hosted 4 biological microgravity experiments developed by 4 Israeli University with Israel. The satellite was successfully launched by Vega with its novel multi-mini satellite dispenser. I read in the web of Space Pharma, messages like thrive on technological risk, ignore the nonsense of conventional wisdom. So I anticipate a very energetic presentation by Yossi. Yossi, you have the floor.
Thank you very much, Franco. Thank you very much, all the audience. I think the NSC is in its second year, and I like to see that it's continuing, although the pandemic is all around us. It is indeed at Space Pharma. Can you hear me? Yes, thank you. So I'll try to share some of the results we recently got from the little satellite. And as far as I know, we are the, can you see that now?
Not yet.
Yeah, you should share the screen.
Yeah, I shared. Now I'll do it again. Okay, I want you to see only this one. This is not, okay, you see all the big.
Thank you for the presentation.
Yes, I'll take care about it in a minute. Can you see?
Yes.
Yeah. Good.
No, it's perfect.
So I will describe the little, we are trying to focus now, as far as we heard that there are enough tools, enough carriers, launchers, fascinating technology and great people all around us. We are trying to focus what can be done with all of this technology. So we are now focusing on delicate, lucrative, very miniaturized systems. All is based on lab-on-a-chip, organ-on-a-chip technology, which we have proven results out of it. You can see here a real system that flown twice to the ISS. This is the schema of the system, but within it, we are running a very delicate wells or capillars where we are creating and building the fascinating experiments controlled from your own comfortable zone, means from your laptop application or from your cellular. We can design those chips upon any client specifications, and we allow you to intervene, means to change parameters while it is in orbit. This is a very small where we build these crystals, and I'm going to show you results. There are very little droplets running on the right screen here. In each droplet, we create a different ecosystem value. So those droplets are now can be, as I said, defined, sealed, the protocol defined and built by the client, and then inside of each droplet, you see here in the middle, there are very little crystals we developed. So we know how to produce protein using anti-solvent to move it within the capillaries, and of course to measure and control the QA while these are built within each droplet. I can tell you that hopefully when the Space Rider will be available, the Axiom as well, and other space vehicles, we will be able to run a very sophisticated machine that will produce 16 production lines within, actually for monoclonal antibodies. Can you still hear me?
Yes.
Good.
Yes, yes,
Thank you.
yes.
So it's like I'm talking to myself. So by having a bigger machine, actually the factory of the future, we like to call it the MOTI, or the modern time, where it's we are planning to revolutionize the ecosystem of production of monoclonal antibodies in microgravity. Each production line will be able to produce 0.5 kilogram of doses, and this is enough for 5,000 patients, and that turns to be economical. And this is the beauty of this system. All the components developed by us, from the miniaturized non-pulsation syringe pumps to the D pumps, of course the organ on a chip and the lab on a chip, and even the optical bench, where we have microscope, fluorescence, and little spectrometry that can read the results and send those back to Earth for QA. There are some tools which are still, here you see some examples, although those are not from orbit, but very little capillaries, who you see the little white things are crystals built on the flow of the reaction, and this is in a 2 millimeter capillary. This is another example of a ground-to-flight histidine, where we create the crystals, and although those are the same dimension, you see that the crystals built in microgravity are much more bigger, and still, after 5 hours of landing, growing and shaping. And this is our first mission to the ISS, where we developed the vilanterol crystallization. This is a small molecule. We are holding the patent of small molecule crystallization in microgravity. This is the same scale, but we got a very, on the right-hand screen, very large and known structure kind of seeds. We grain it, then we take it to seed seeding factory on Earth, and we can produce from 1 gram, 1 kilo. And 1 kilo, it's also enough to build enough dosages of the vilanterol. In this case, we build the vilanterol in order to deliver it to the body in a much more user-friendly way, using inhalation machine. So it's like very little dust or very little colloids that can sniff into the body, stay in the lung much longer, and the lungs recognize it as a good thing without coughing it out, as it is on the left-hand screen, since we did it in orbit. So that shows that small molecule crystallization can make a rebound and renovation back to the pharmaceuticals today who are rarely using those structures. Back to the shapes of the crystals, we are going to plan very soon to propose to the market a factory of the future, which in each flight we will be able to generate 16 production lines that each line can produce around 400 to 500 grams of purified crystals or monoclonal antibodies. And those can be either go to be the seeds on Earth or going to be separate for dosages and injected to the body. We understand clearly today that the subcutaneous means the way of delivering the medicine to the body instead of taking the patient to the hospital during COVID time and expensive expenses. When you take a patient to the hospital, we can turn even the Keytruda from hospital care to home care by saving money and save the cost of the production of this medicine, means the monoclonal antibody. And this is the results of our DIDO-3 in orbit. DIDO is the only autonomous laboratory in orbit today, except of the ISS. We are unmanned. It's a 5.6 kilogram, 16.2 voltage, and actually 4 experiments designed and built by 8 scientists, PIs, top PIs from Italy and Israel. We have hospitals and Polytechnic, the Technion, the Hebrew University, and they generate fascinating activities in orbit. Actually, I can tell you that 3 of the 4 experiments successfully accomplished. One of them is still under a debate. And I think the fascinating things that we learned during this mission is not the spectrometry graphs that you see here, or the voltage, or the temperature, or the magnifiers. I think the beauty is that we learn that we can define a scientific group. A scientific group is a team run by a mediator. We have 2 PIs, sophisticated people from Italy and Israel, and another 2 PhDs joining them. So these together are 5. We have a data miner expert, another PhD who take care about the data, because we are producing data 6 times a day, each time 12 minutes about Switzerland. We collect down the data stream and then disseminate it to the clients. So we have a data miner expert, and we have a satellite operator and satellite health check expert who verifying that the technology is sustainable enough, that we are producing enough power to run everything within the lab, mean the microscope, the spectrometry, and other activities. And we could achieve 25 Celsius degrees on a sustainable way. Means it's the room temperature in orbit without being within the ISS, without using an astronaut. And the top temperature that we even achieved, I think, was around 39 Celsius degrees. So we can also mimic the body temperature in order to compare the results coming from orbit to a patient here on Earth. So after learning from the scientific group, how is it nice to work together? We have 3 missions during the night, 3 missions during the day. We learned that most probably the space is the control, while Earth is the post-experiment environment where we must run the experiment after it was executed in orbit. The main reason for that is that space is harsh, and sometimes there are some solar eclipse and even a CPU failure that we could not predict in before. So what we are doing, we are recording all the data in orbit and then transform it into a script and run it in a post environment here on Earth. And by that, we are generating a very reliable information coming from orbit and then replicate on Earth. And that shows us what is the delta and why is it so important to go and to research in orbit. So the experiments that we had in orbit was 4, as I said before. We had space lysis where we took enzymatic reaction with bacteria in order to produce a very antibacterial surface or a new kind of coating, and that was a very successful experiment. The second one was the NDA folding. That was most probably a failure, as within 20 minutes, unfortunately, due to a computer reset, we had missed the reaction. But as we learned before, and from a fascinating lecture, we need to learn from failures as well. So that was not succeeded. The third experiment was the albumin binding to a blood protein was another successful in orbit. And the fourth one, just announced today in the conference, is that we were very successful to verify conjugation of plasmids moving from one bacteria to another while trying to defeat it with antibiotics. We know today that the bacteria are very strong. Those survive and could not be defeated by the antibiotics that prepared, but that can show us how to improve antibiotics for in a case that a bacterial pandemic will attack human being or mankind on Earth. That is the right way to improve antibiotics in orbit. So we are very successful in this mission. The fifth way that we were trying to do in orbit this time was, and it is also successful, is we have a retroreflector on board the CubeSat or the CubeLab, and we can communicate with this retroreflector using a laser beam. So we have 5 experiments. 4 were successful. 1, unfortunately, could not be executed due to a failure of the computer. And we are very, very happy to say that the next mission is going to be a lot of regenerative medicine and a lot of reactions trying to either produce organ, skin, and monoclonal antibodies in orbit, or even to learn what's happening in orbit and translate it here on Earth for a lot of brain diseases. This is my lecture. I would like to thank you again, and hope to see you next year.
Thank you, Yossi. Indeed, you showed that your company is really doing manufacturing in space. It has been for many years preached as a perspective, as a real perspective, but you showed that it is possible. I was just curious, the life cycle of your mission could be shorter than an exploration mission on the ISS. So Space Rider might be a good tool for you. Am I right?
Absolutely. Yeah. The mission that we are producing right now for chemistry is very fast. For life science could be few weeks up to 16 weeks. The Space Rider is the mission or the space vehicle that we are really waiting for, as we will be able to produce mass production of skin, organs, and many other body parts that we believe that in orbit we will be able to shape the 3 dimension, where on Earth it's still very complicated.
Thank you so much, Yossi. I must go ahead. We are again running against time. The next speaker is Dr. Lance Black. He is the Associate Director of the Texas Medical Center TMCX and biodesign, and he serves board position for TRISH, Transnational Research Institute for Space Health. As a background, is a family medicine physician, biological engineer, and now is a supporter, a coach of healthcare entrepreneurs, if I interpreted correctly your web. With this background and experience in medicine and biological engineering, Dr. Black professional focus today is the design and development of innovative medical devices. As I understand it, the TMC Innovation Institute aims at integrating cutting-edge technology in medicine and help companies and then entrepreneurs to take their products from bench to bedside. Anticipate you, Dr. Black, will discuss your work with health companies at TMC and also your activity at the Transnational Research Institute for Health. You have the floor.
Thank you so much, Franco. It's nice to be here, and appreciate NSC for the opportunity to speak with you all. Generally, when you think of Houston, we have a problem when it comes to space. Now Houston has more than a problem. We have actually a number of solutions. You may know that NASA has their Johnson Space Center in Houston, Texas, but what you may not know is actually the world's largest medical center also exists in Houston. I'm going to share my screen to show you a little bit about what I'm talking of here in a second. All right, can everybody see my slides?
Yes. Yes.
Great, thank you so much. The Texas Medical Center is truly a marvel. It's a unique collection of independent healthcare systems, all co-located within about 2 square miles just southwest of downtown Houston. It truly is a medical city. It comprises 63 different institutions, 21 of which are hospitals. The remainder academic institutions, research organizations, many of which could stand on its own merit, but collectively really presents a powerhouse for any, in my frame of reference, any entrepreneur to really prove out their business hypotheses when coming to explore their medical device or digital health technology. And so we work with hospitals like MD Anderson, Texas Children's Hospital, Memorial Hermann, Houston Methodist, Rice University, and of course, NASA. Within TMC, we serve over 10 million patients per year. We employ about 115,000 people. So if you think about us as a city, we're actually one of the larger cities in the US just from the amount of employees that come into work on a daily basis. A surgery is done every 1 to 2 minutes, a baby born every 20 to 30 minutes. We bring in more extramural funding than anywhere else on the planet, exceeding 2 billion. And the total patient beds is over 10,000. And just to provide some perspective or context, if you took the great city of Boston, for instance, and you collected all of their hospitals together and you put them into one small geographical area, it'd be about 7,000 hospital beds. TMC is just the nucleus of a multitude of health systems around Houston, but just within that nucleus, we have more healthcare being delivered than anywhere else on the planet. And so what does all this mean? And why does this matter for space health? It matters for a number of reasons. We are constantly exploring the very cutting edge technology within healthcare, working with startups. And I'll explain exactly how we do that here in a second. But I'm gonna posit something that I think may be a little bit different than some of our panelists. We don't have a problem with technology or technology availability. In fact, I think we have what we need now to continue to push ourselves throughout the space continuum for the mission to Mars even. What we have a problem with is understanding how to validate that technology and really appreciate the human factors element and the commercial potential of that technology. Obviously, we can't just produce technologies for space. The market is too small to be able to support a lot of great technologies, but there's numbers of technologies that we can translate from the commercial setting into a space setting. And we help do that at Texas Medical Center Innovation through a multitude of programs and corporate partners. And what you see here is just a blueprint of our campus that sits right on the periphery of the Texas Medical Center. And so we're positioned to bring innovative technologies into these great health systems, as well as pull great technologies that are coming out of our research organizations and to help understand commercialization potential. It doesn't matter how exciting your technology is, if you cannot make something of it on the commercial end, the chance of it making it to see the light of day and to helping patients and ultimately helping providers is slim to none, as most of us know. And so I was going to pull out a couple of these programs to highlight. I'm going to focus on TMCX because I think it's the most relevant to our conversation. But I just wanted you to get an understanding of, yes, there's tons of accelerators and incubator models out there, and there's corporate partners that are trying to get into innovation. But our focus really is on proving out that technology. So you come to us once you think you have something that merits patient use, and then we provide the marketplace for you to be able to test that hypothesis. And TMCX is a great example. TMCX is a medical device and digital health accelerator. And we act as innovation partners to our health systems. It's very difficult, especially during times of COVID, for providers, for healthcare administrators to think 5, 10 years, much less 1 year into the future. They're so overly focused on the present because of having to put out fires and just to be able to make it to the next day. They don't really have future thinkers, if you will, integrated into their daily practice. That's where we come in. That's where we push the boundary. We say, this is what's going to be happening in 5, 10, even 20 years from now. How are you preparing your health systems in order to incorporate that new technology? So we're focused and engineered to bring value to these health systems to develop and refine our startup's enterprise strategy. We're playing with the big boys in Houston. You have to understand how your technology is going to work in the hands of thousands of physicians, tens of thousands of patients, and health systems that employ over 15,000 individuals. Because your technology may work in the lab or maybe even work in a very controlled setting, that's not quite the same as giving it life through a real legitimate marketplace like Houston can offer. And so we promise a set of curated resources, and I've heard some of the panelists talk about this. If it's legal, if it's reimbursement, quality, development resources, whatever it takes to make sure that these startups have the best chance possible when they're meeting with these potential partners, knowing full well that they'll never make it to market if they can't convince these partners to adopt and to work with them around their new technology. And let me just break down our process very simply. We partner with institutions and organizations like NASA, like TRISH, Translational Research in Space Health, and of course, like our hospitals. And we ask them, what are you looking for? What is your areas of interest? Where do you want to focus your efforts in the next few years? Is it virtual health? Is it remote monitoring? Is it cardiovascular devices? And then we use that as a call out for startups around the world. And in fact, we've had some great Italian startups participate in our program. We have them come through an application process. We do a screening, which is much like a job interview. And what we're looking for is just to really vet whether or not there's a real business here. Is this going to be something that extends beyond the lab and actually has a role and responsibility within the marketplace? Is there the right executive management team? Do they have their intellectual property secure? Do they understand how they're going to price, how they're going to get reimbursed? These are fundamental things that we all probably understand, but oftentimes we get enamored by the technology and its capabilities, and we lose sight of what truly brings that technology to life, that vehicle, that entrepreneurial opportunity. And then we put them in what we call a boot camp. Much like a military boot camp, we are really stressing these companies by putting them through a number of different meetings and series of events, really trying to understand how well they appreciate their strategies. We put in front of them our hospital partners, our stakeholders, subject matter experts, and we really try to tear apart where they are at their weakest so that we can understand how to support them and help them. And then from boot camp, we select usually a handful of companies and we work with them for about 6 months focused primarily on a relationship between that startup and one of our organizations. And then ultimately it culminates with a conference where we showcase how that startup was successful or not successful with one of our partners. And just as a most recent endeavor, we went through our 11th cohort. So we've now been doing this for about 6 years, and we do about 2 cohorts per year. And so we had 21 companies come through our last cohort. We actually just selected the 7 that we're going to bring through our program. But I wanted to highlight a few of these companies because I think they're particularly interesting, especially as you consider space applications. We have 5 different categories here, and as you can see, a lot of it was spent on brain and mental health. I helped to serve on a board that's focused on looking at healthcare and the mission to Mars. And one of the biggest topics that comes up time and again is the mental and brain health of the crew, as we can all imagine. Spending 3 years with a crew of 4 when you are so remote from home has a lot of toll on your mental health. And so we're looking at technology that can advance that. As an example, bottom right, this company called Feel. It's a wearable device that ascertains your heart rate variability, and other biomarkers to determine what levels of stress you're undergoing. It then alerts the patient or alerts the user, hey, you're currently going through a lot of stress. Now's the time to take a break. Now's the time to video log what your emotions are, what brought you to that level of stress. And so it's an indicator to kind of stop and pause what you're doing so that you can understand why your body's reacting the way it is. Cognitively neurosciences, a very interesting research coming out of the United Kingdom focused on looking at neurodegeneration. And so they can flash images on a screen of animals and of different pictures and determine by how quickly you recognize animals whether or not you're undergoing significant cognitive stress, whether or not you're going through more chronic changes, things like Alzheimer's or other forms of dementia. Elios, another great example of something that has space applicability. Very, very stout voice analytics platform. So they're recording conversations happening between physicians and their therapist, between their therapist and a patient. And they're being able to pull that from voice analytics, what the patient is experiencing, or how they use words to describe their emotions, or how they recount and answer certain things around their past. And able to use that to determine and to supplement the therapist's clinical understanding of what the patient is currently going through. On the cardiovascular side, I want to point out a couple RCE technologies. It's a wearable troponin sensor. For those who don't know what troponin is, it's a biomarker within our blood that tells us whether or not our heart has undergone any kind of injury. So we use this lab test to ascertain whether or not a patient is having a heart attack or myocardial infarction. This technology they developed is a wearable that does the same thing. You don't have to take blood from the patient. You don't have to send it off to lab. It's like a watch that's telling you whether or not your heart is undergoing injury. So you can imagine that information plus additional information like ECGs or vital signs, we can start to predict the likelihood of a crew member or a patient of having a heart attack or having cardiovascular stress. CardioSense, another wearable that's picking up filling pressures and flow volume information that typically can't be understood unless you have catheters inside your body, like in the ICU. Able to do this now at home or remotely. And so you can see on the cardiovascular side, very heavily focused on remote monitoring and understanding all the key metrics that make us understand better what a heart patient is going through. And I'll finish off with just highlighting one more company, robotics field, Harmonic Bionics. Really interesting upper extremity exoskeleton that can diagnose and assess shoulder problems in a patient. And then once it does that, it can also help to assist in rehabilitation. So walking the patient through different motions. You can imagine giving our astronauts an upper hand if they do get injured in flight, or if they even need additional strength to perform certain tasks. How robotic like that can really impact our crew. And so I'll just close, excuse me, briefly with just saying TMC Innovation has worked with hundreds of startups, many of which have space applications. And so we're very focused on understanding how to translate from a commercial entity into a more novel setting. And I'm happy to answer any questions, of course, and would love for anybody, if they have a great company that they're excited about exploring what Houston's about and getting connected to not only our health systems, but to great organizations like NASA. Love for you to reach out. Thanks for your time.
Thank you very much, Dr.
Thank you very much, Dr.
I hear echo, but I think you understand. Well, I was just curious. A long time ago, I worked as a postdoc at the NIH in Washington. How does TMC compare to NIH in terms of size and engagement in entrepreneurial activities?
What's interesting about TMC as opposed to NIH, of course, being a government-run facility, TMC is all private nonprofit organizations, but it's a variety of independent organizations. And so we have a number of research bodies and groups that are collaborating, that are competing, that are working on different technologies, undergoing the same grants. And so I would say it's around a variety, and also heavily invested in corporate relationships as well, to make sure that that research has a commercial spin on it.
Okay, thank you. Thank you so much. Well, perhaps we will have time for some questions at the end, but now I'm going to give the floor to Pietro Faccioli. Pietro Faccioli is an associate professor of theoretical physics at the physics department of the Trento University in Italy, and is also the founder of a startup, Sibilla Biotech, engaged in drug discovery. With a background in high-energy physics, Professor Faccioli has developed advanced mathematical methods to study biological systems. And as I would call him a computational biologist, he develops models to describe protein dynamics. You will correct me if this is not exactly right. There is a legitimate expectation that experiments in weightlessness, therefore in space, may help validating these models better than in Earth labs. What we heard from Yossi just minutes ago is somewhat encouraging, I believe. You have the floor, Pietro.
Thank you very much. Can you hear me?
Yes, we do. Yes, we do.
Very good. So first, thank you very much. It is very exciting for me to be here because, as you can imagine, I'm completely newcomer into any discussion that concerns space. So it's a completely new experience for me and an exciting one. So what I would like to tell you today about is what I would define a possible new frontier for protein crystallization in space. And I would like to start by summarizing my talk in just two statements. I will tell you a little bit about an entirely brand new paradigm for performing drug discovery that we have invented together with collaborators that I mentioned later on in the talk, and then transferred to a company. And I will try to argue that there is an opportunity specifically for space economy to leverage on that invention. So to reach that goal, assuming no particular background from the audience, let me just remind you how standard pharmacology drug discovery, rational drug discovery, or standard pharmacological research is performed. Well, typically sits at the bottom of what is called the fundamental dogma of biology. You see there this standard paradigm according to which you have, genetic information transferred to the ribosome through the messenger RNA. The ribosome basically reads the genetic information, produce chains called proteins that are chains of amino acids, and these proteins fold, acquiring a unique structure. And basically, this is an example of a unique structure. What standard pharmacology does, it tries to target the structure with small molecules that have the function of impairing the biological functions of these so-called nano machines, biologically designed nano machine. There are other paradigms that have established very recently, in particular gene editing, you might have heard of, which acts on a different point of this dogma, if you want, very early on, trying to suppress the expression of genes, and therefore ultimately the expression of the protein that is involved in a given pathology. Right. So we will discuss a new paradigm that will act in the middle, that is in this new layer that you see here. Basically, while the protein is folding, I will discuss a paradigm that is based on stopping the protein folding process through the action of small ligands. So in other words, preventing the protein to reach the biologically active state where it can be potentially harmful as involved in pathology. So why can we do that? This is all rooting on some technological development that has been in my lab over the last several years. We were involved in the development of advanced simulation techniques for rare biomolecular transitions, and using a number of methods that we inherit from high energy physics, never mind the details. The important point is we ultimately were able to predict the protein folding pathways given the structure, the native structure of the protein, given the biologically active structure of the protein. So this is an entire new wealth of information that has become available since before these algorithms were invented. Basically, atomistic model could only simulate the folding of proteins that, not biologically relevant, maybe small fragments folding in sub-millisecond scales or things like this. Right? With these methods, we really access what I call the biozone, the real biologically relevant proteins. And by doing that, we could characterize how the folding process actually occurs for protein and realize that many proteins fold according to what are called intermediate states. There are partially folded states that are very frequently visited during the folding process. And since we were more or less the first ones, I would say the first ones, to be able to completely characterize these intermediate states atom by atom, we had the idea of inventing the principle of finding molecules that can bind to these newly discovered states and stabilize them, hence preventing the reaction to proceed and the protein to finish the formation and therefore never reaching the biologically active state. Now, why do we want to do that? Because the cell has a very efficient quality control that can recognize whenever proteins that are around are not correctly folded and targets them for degradation. Basically has a sort of a quality control system that gets rid of partially or incorrectly folded proteins. So we let the drug, we put a drug in the cell, the drug stops protein folding, and then the cell does the rest, gets the protein and sends it to a trash can, so to say. So typically our working protocol works like that. Before we do our protein folding simulation, we identify an intermediate. This is an example of folding intermediates. In the intermediate, we look for drug pockets, like in this case. And after we have done that, we perform standard drug screening over a database of compounds to perform what is called in silico drug screening, to look for, in this database for molecules that can have a high affinity to these intermediate states, and therefore have a potential to stabilize it and prevent the folding process to proceed. Now, we had a number of applications of this principle. Maybe the one that was most thoroughly performed, and also the first one in temporal order, is the one on the prion protein. The first application challenged a very difficult task, that of drugging an undruggable protein. So the human prion protein is a physiologically produced protein that we have mostly in our brain. And occasionally this protein can change conformation, and mostly due to the exposure of a seed of misfolded protein coming from outside, for instance. And whenever it changes conformation, it leads to aggregation, and toxic aggregates basically are lethal, and all patients die with 100% probability. This is one of examples of prion-related disease is the famous mad cow disease, the stroke in the late 90s, Europe. So unfortunately, the human prion protein, the healthy prion protein, is considered undruggable, and basically no treatment has ever been conceived for prion-related disease. So we tried to see whether we could suppress the expression for prion proteins, therefore reducing the substrate for these unhealthy aggregates that I was mentioning before. Now, I will not discuss this data. I just want to mention that basically by applying the pipeline that I described to you before, our novel drug discovery platform, we were able to actually identify molecules that are able to dose-dependently modulate the density of human prion proteins in cells, or what is called technically the expression of human prion proteins in cells. You can see concentrated on the graph on the right, as you insert this higher and higher concentration of these drugs into the cell, or putative drugs into the cell, I should say, the levels of expression of these proteins go down, as you would expect. But the toxicity remains basically unchanged for up to very large concentrations. So this discovery led to founding Sibylla Biotech, which is now being supported by a major investment from venture capital, by multi-million investments a couple of years ago, and now is sort of setting the stage for a major scale-up. And Sibylla has been involved in a number of drug discovery initiatives which have to do with this invention. And in particular, in response to the COVID pandemic, Sibylla was involved with other academic partners in trying to find a way to suppress the expression of AC2 protein. And you might have been familiar now with this name because it's been in the news as one of the two proteins that are involved in COVID replication. From the virus side, you have the spiky protein, and from the cell side, you have the AC2 proteins that provides the anchor for the virus to attach to in its early process to penetrate the cell. Now, what we did exactly what I described before. We folded this protein, found an intermediate, found a pocket in the intermediate, and we ran the screening campaign. But this time we screened over only drugs that were already either approved and on the market or in a very late stage of clinical trial, trying for what is technically called a repurposing, meaning repurpose a drug that was designed to do something in order to let it do something else. Well, by doing this, we were able to discover a molecule that actually we proved to have antiviral activity in cell colonies. In other words, being able to stop the spreading of COVID infections in cell. Well, there's a long way for this to become a real drug anti-COVID. We need, animal models and ultimately human model, clinical trials. But it is at least a strong case in emphasizing the potential, because this time we didn't pick the protein. We had to pick the protein and find a way to stop it. So I think this was quite a striking example of why this new paradigm for drug discovery may be potentially, I would say, revolutionary to some extent in rational drug discovery. So that's probably quite, a question that one may ask is, why should we be interested in that, being this a forum on space economy? So why going to space may be involved in this research? Well, I want to, in order to emphasize that, I would like to go for an industrial perspective. So let's make a step backward and think about traditional drug discovery. Like I said at the beginning of this lecture, traditional drug discovery is based on targeting protein native states. And of course, what you do, if you wanted to do that rationally, meaning not by serendipity, you have to have some knowledge on the structure of the protein. And most of this research is done by performing experiments, in particular X-ray crystallography or NMR experiments, that can provide the full native structure of the protein. And then once you have the native structure, you can look for ligands that bind, but you can also go ahead during the refinement phase of drug discovery. After you have a hit, there is a very rare molecule that is shown to have some effects on the target. You have to go through a long phase of refinement, optimizing both affinity, lowering toxicity, looking for pharmacokinetics and all that. And in this, so to say, so-called to-lead phase, it is extremely important to have all the information, all the structural information about the binding pose of the molecule, so that you can look around, see the chemical environment, and search for the right atom and be guided in the process of optimization. Now, for standard pharmacology, there is X-ray crystallography and NMR experiments that can provide this. We have heard recently also of possible computational advancements for in silico predictions. It should be mentioned, though, that in silico prediction can only predict structures that are of the same families of the structures that have been discovered by crystallography. You cannot predict structure that belong to completely different architecture simply because they are based on an artificial intelligence that have been trained on structure that have been obtained. So in any case, it is very crucial that you have an experiment performing structural characterization. Now, obviously, it would be fantastic if we could have the similar experimental information for our new paradigm for drug discovery that is based on targeting protein folding partially folded state or intermediate states. We are in the opposite situation. First came molecular simulations by my team that were able to predict these structures, and we are still lacking for experimentally resolved data, experimental data to provide the ultimate proof that that's the structure of the binding pocket, for instance. Unfortunately, performing these experiments on protein folding intermediates has proven impossible on Earth. And basically, the reason is that protein folding intermediates expose large hydrophobic so-called patches to the solvent, which means basically that if they are exposed to the solvent for a long time, they tend to aggregate into amorphous structures that have no use for, they become insoluble, they precipitate, and in any case, they are useless for crystallographic studies. So on Earth, there is no way you can form a crystal of proteins stuck in their intermediate state. And from here, the idea of exploring the possibility of performing experiment in microgravity conditions, either on Earth or in parabolic flight or even on the ISS. Because in fact, in space, as you heard from previous lectures today, there are some kind of a better suited conditions to perform crystallization experiments. In particular, the absence of convective motions and precipitations, really, alters the rate of aggregation with respect to the rate of crystallization in favor of the rate of crystallization. So we are very enthusiastic to discuss, for instance, with scientists at Space Pharma, paving the way to conceive the possibility of experiments to provide structures of protein folding intermediates in space. I believe, together with my collaborators who've been deeply involved equally with me in this venture, I'd like to mention Emiliano Biasini, Letizia Berecca, Giovanni Spagnoli, Graziano Lolli, among many others. We are deeply convinced that there is a strong scientific case for this because there's a number of important scientific questions that can be asked about folding intermediates. For example, should they have a biological, physiological role or not? But aside from all the scientific questions that excite us as scientists, we believe there is a potential for an economy there, since space may be the only laboratory, or microgravity condition may provide the only kind of laboratory where the structural information can be obtained experimentally, and therefore play an important role should this technology for drug discovery becoming popular in the future. And with this, I think I would conclude.
Well, Pietro, this was a very very interesting presentation. As you said, it would be interesting to hear a reaction, a comment from Yossi Yamin. I don't know if he's still with us. Maybe not. I believe that we've had a very long session, and thank you, by the way. You were with us from the very beginning, so you have listened to all the presentations, and certainly there is a room for further cooperation. Actually, this is probably one of the goals of the forum, to get people to talk to each other and learn from each other about opportunities, models, ways of going ahead. So I believe that in this sense, this event has served many purposes. It's not just a, I should say, display of interesting things and extraordinary activities in space, but it's really a promoter of new development, of far-reaching innovation, and I think this session was very, very interesting, and I should be grateful. The forum should be grateful to all the speakers who have participated. I'm afraid that most of them have disappeared because it's been a long day without a coffee break or anything. I'm sorry for that, but it's also because speakers had many things to say. I see still Peter, Giorgia, and of course Pietro. So I think we can close here and maybe see each other next year in person, hopefully. I don't know if there is any comment that anyone wants to do. Thank you, Peter. Thank you, Pietro, and Giorgia, and see you next year around. Thank you. Bye now. Bye.
Thank you. Bye.